Hey, Dr. Christianson here, and I want to talk about histamine intolerance. We can think about this in a spectrum of issues with histamine and mast cell regulation. We've also got mast cell defects and mast cell activation syndrome, which are very similar. Now, the first question is always, is this a real thing, or is this some kind of a fad diagnosis? And I would argue that no, there's clear data saying it's real, that it's an actual phenomena that does happen, and it certainly has been underdiagnosed. Many have had it and suffered and had symptoms, but not had an explanation for the symptoms. But I would also argue it does have the risk of being overdiagnosed, and I'll talk more about that. The first thing I'd love to say is that histamine intolerance is a horrible phrase. It's very misleading because this is not an intolerance to histamine. This is not an allergy to histamine. This is not an autoimmune response against histamine. Histamine is a normal part of our bodies, and to date, no humans have been documented as being intolerant or allergic to histamine. It's actually the way we manage and initiate an immune response by forming it. So what is it? Well, it's probably more accurate to call it a histamine overload, because anyone, if they get too much histamine, they get these symptoms, and they can be classic allergic symptoms. Nasal congestion, sneezing, difficulty breathing, swelling, tongue swelling, hives, skin rash, flushing. These are classic symptoms that you could take anyone, give them a megadose of histamine, they would develop those symptoms, and they can be life-threatening. But what's happening with histamine intolerance is that people are running at a higher background level of histamine than they should otherwise. So it's not that they're intolerant of it, they just got too much of it. They've got more than they need circulating in their bodies. Now, those are some of the more specific symptoms of high histamine, but a lot of vague symptoms can come from chronic elevations of histamine also. And this is where it gets murky. That can be changes to the menstrual cycle, generalized fatigue, headaches, migraines, difficulty sleeping, having a hard time waking up and being energized, high blood pressure, vertigo, dizziness, cardiac palpitations, poor regulation of body temperature, anxiety, nausea, vomiting, abdominal cramps. So these are all possible symptoms that can associate with it, but can also come from so many other causes that it's hard to think about those more specifically. So why would someone have too much histamine? Well, think about it like there's histamine coming in and histamine going out, are the main two things your body's doing. So you could have too much histamine coming in or too little going out and get the same set of symptoms. So histamine comes in as a natural response to an allergy or a chronic infection or some kind of trauma at a chemical level to your body. Histamine goes out by various enzymes that break down histamine. We've got diamine oxidase and monoamine oxidase. Histamine is one of several amines, one of several biogenically active amines, and they trigger inflammatory responses. So you could have too much of these things being made and not enough of these things getting unloaded or having your body eliminate. So the former is more probable. The latter, as far as gene defects, in which people cannot properly get rid of histamine, are quite rare, and they're also severe, and they're typically present throughout the lifespan. They're not so much things that would show up over given points in time. So DAO deficiencies, the diamine oxidase deficiencies, they are possible, but they're not very probable. And just from seeing populations thinking they have a lack in that, I would argue that's being overly suspected or overly diagnosed. And one of the reasons why is because all those symptoms are vague symptoms of many other conditions. Now, the diamine oxidase deficiencies, those are measurable. You can measure that in the blood. And this is back to the whole thing about false positives, false negatives. So you can see it when it's there. Many make an argument that you can't always see it when it's there. So someone still could have it even if it were not measurable. And the same is true for high histamine in the blood. You can see it present, but you can't always see it present even if it is happening. So that's where the diagnoses get murky. And this is tough because it does take a lot of judgment, and there's no easy pat across the board answers that satisfy all situations. But when you're entertaining a diagnosis that you can't objectively affirm in some way, you've got to tread really lightly, because very, very possibly these could be symptoms that are misattributed from another cause altogether. So there could be something different but unrelating that's causing the exact same symptoms. The other odd risk is that many of these symptoms, even some of the symptoms like the hives, the flush, the rashes that can form, these can come from stress and anxiety. So one can have very real physical symptoms but misattribute them to something like a diamine oxidase deficiency. So it goes both ways. There are many that do have these problems that have not been diagnosed, but it can be overdiagnosed. So it does take just a lot of curiosity and not getting too attached. You know, that's a drawback about the scientific process, is that you can't jump to conclusions. You can't say, oh, I've got these three, four symptoms, that looks just like me, I've got to do this. Well, it's better to always suspend judgment and say, this is plausible, this could fit my symptoms, what else could fit my symptoms? And do the things that help these conditions help me feel better. So here's more of the problem between whether or not you've got a solid diagnosis. You can diagnose this empirically. And what that means is, would treatments that lower histamine help your symptoms? And it's not unreasonable to say, hey, if histamine blockers make me feel better, then I must have a problem with histamine. That's not unreasonable. But the difficulty is that histamine affects a lot. You know, your overall state of mood, your state of anxiety, your state of just stress or panic. These are all things that antihistamines lower. You know, it's no secret that we use Benadryl as a sedative because it's an antihistamine. And diphenhydramine, which is also Benadryl, most people, it just knocks them out. So let's just say someone had a high level of a high stress load in their life, and that was manifesting for whatever reason in skin symptoms. It's entirely conceivable that they could take Benadryl and lower their level of stress and panic, and therefore misattribute this change in symptoms to being related to or being caused by histamine. So those are the things to tread lightly about. Now the other difficulty is that we talk about histamine, where does it come from? Well, the body makes it in response to infection, stress, or trauma, but we also do get it from some foods. There are foods that contain histamine directly. And there have been times in which foods have been contaminated. So if foods are not stored properly, if they've fermented in some way unwantedly, they can have bacterial genesis of amines. The bacteria can make a lot of amine compounds. And in those cases, that can actually be lethal. If you consume high, massive amounts of histamine from food, it's no joke. And there have been documented cases of deaths or severe outbreaks of histamine toxicity from high levels in food. But then many have extrapolated saying, oh, okay, so if that's possible, then maybe the small amounts normal in food could be a trigger if I'm sensitive. And that's plausible, but what's happened is that there have been many studies looking at how do we quantify the histamine in foods, how do we measure that? And so far, those studies have had no agreement whatsoever as far as what are high histamine foods. Now, there are some big generalized trends. So cured smoked meats, aged cheeses, fermented foods, shellfish, those are categories of food that are generally higher in histamine, more than 50 micrograms per gram, than pretty much all other foods. So those categories of foods, if they clearly cause symptoms, that could be relevant. But I can't really endorse other histamine food lists because if you go deep in the research, they're contradictory. And there are many tables and graphs that have been done comparing these various food lists, and there's not much agreement. And let's say you wanted to say, well, I'll just cut out all the high histamine foods. You're not left with any foods, not many foods. There's not, if you want to take everyone's food list at face value and cut out all the other foods, you've got almost nothing to choose from. And there's not evidence saying one of those lists is better or more accurate than the others because they're contradictory. So if you do suspect this, the other consideration is there are diamine oxidase replacement compounds, which are taken from pig tissues. You can take that in pills. And there are mast cell stabilizing compounds, which are really a lot of good bioflavonoids, which you can get from a variety of fruits and vegetables. This is funny, but I had a big smoothie with a chunk in here. This is golden beet. Can I not make a mess by taking this out? So that's a chunk of golden beet that didn't quite make it through the blender. In this, I had pomegranate, I had spinach, there were kiwi fruit, there was some orange pith, the little white part around there, lots of other foods that are high in phenols, which lower mast cell degranulation. So the cycle is that mast cells store histamine, and when they pop open or degranulate, they release histamine. So if the mast cells are not as trigger happy, you're less apt to get histamine symptoms. And honestly, any kind of pigmented or colored plant food probably lowers that. Quercetin is a compound very rich in onion and onion skin that lowers that. And then also rutin, which is ridiculously high in buckwheat, and also bell peppers, more so the mature ones like the red and the yellows. Those also can lower that histamine release from the mast cells. So those are great strategies, but the mindset I would encourage, if you feel you've got these symptoms, do test. If it's obviously there, that's worth pursuing or treating. If it's not there, consider a trial of lowering histamine in terms of the obvious foods, and think about things that help stabilize the mast cells. And most important, look deep at any hidden infections, gut issues, airborne allergies, food intolerances. Those are the more likely culprits. If you chase histamine intolerance disease onto itself, and it's not measurable via diamine oxidase activity or histamine levels, you don't know for sure if that's what you're dealing with. And even if you strongly suspect it, you'll never know if you've gotten a handle on it. So test, don't guess, objective data matters. And do know that it's easy to get down in the murky weeds with some of these things. And I don't want you there. I want you healthy and happy and vibrant. All right, take great care. We'll talk again really soon. Bye-bye.